Doctor, what can cause discharge after sex?
Discharge refers to a mixture of fluids that comes out of the vagina or penis. People may notice discharge before, during, or after sexual intercourse. In a male, healthy penile discharge is either pre-ejaculate or ejaculate. Certain factors can influence the amount and appearance of discharge. The consistency of vaginal discharge, for example, naturally changes throughout the menstrual cycle. However, some changes in discharge can indicate a health problem. Healthy vaginal discharge is a clear or white fluid. Any other color may indicate underlying health problem. Some common causes of vaginal discharge after sex. 1. Arousal. When you are sexually aroused, it could cause vaginal or penile discharge. The discharge may be thick and have a clear or milky white appearance. However, if the discharge is very thick, has a foul smell, then it indicates a health problem or infection. 2. Female ejaculation. During sex, a female may ejaculate. This involves expelling fluid through the urethra. 3. Menstrual cycle changes. At the beginning and end of the menstrual cycle, the discharge may be thick and white. During ovulation, it may be clear and stretchy. At other times throughout the cycle, discharge may be clear and watery. Toward the end of the menstrual cycle, old blood may be present in the discharge, giving it a brown color. All of this is normal and not a cause for concern. 3. Bacterial vaginosis. Bacterial vaginosis, BV, can make discharge after sex more noticeable. It occurs when the pH of the vagina changes, disrupting the healthy balance of bacteria in the vagina. Having a new sexual partner, multiple partners, or regularly douching can increase the risk of developing BV. BV can cause discharge to be off-white or gray and have a strong fishy odor. It may be easier to identify BV discharge after sex. Symptoms of BV include an itching or burning sensation in the vagina, an itching or burning sensation around the vulva, painful urination. If any vaginal or penile discharge is foul-smelling or unusually colored, see a doctor. These symptoms can indicate an underlying health condition, such as BV, a yeast infection, or an STI.
Thank you, sir.